Thank you so much. That was just, an amazing performance. I know we're dealing with some very, very tricky, difficult topic. Would you like to come down, please? Henderson, yeah. And just to give just a summary, really, of what we've just seen. We're going to have a panel discussion later on, but I think you guys did, so very brave of the men, first of all, to share their stories and be willing to, and of course for the actors who have, depicted their stories with such respect and care. Over to you.
Lovely. Thank you, Lorna. First of all, put your hands together properly for the actors, for the boys. Yeah, proper round of applause. Let them hear you in Brixton. Okay, so we've said about the applause, but for me, personally, that was so moving. And it was so powerful. And I heard laughter, and then I heard people break on the laughter when they realised what the information was. So respect to yourselves. Give yourselves a round of applause to the audience because you appreciated what they were doing. So well done. Powerful stories shared by the actors, portraying their experiences with such care and respect, like Lorna said. We know that the themes explored may have stirred up emotions, and may have you guys thinking about maybe family, friends. So outside in the lobby, if there's anything that's affected you, that you've seen or heard, then please, there are volunteers out there, and they are people that you can talk to in confidentiality, and they can provide information, signpost you to where you can get further support and resources. So please, don't waste the opportunity. Can I see some head nods? All right, cool. All right, to the men who just performed, run their own prostate cancer support groups. One is Jeff Thompson. Come forward, Jeff. And Jeff's the founder of Cancer Don't Let It Win. He's got a banner outside so you can go out there and get some information. The other, my boy, PC, Paul Campbell, who runs Cancer Black Care. And there's leaflets about both the organisations outside plus more. And the evening doesn't stop there. Are we spoiling you? Are you happy? Yeah. Okay, good. Because there's more to come. We now invite you to stay for our post-show discussion with health professionals, where you have the chance to ask questions and to continue the conversation. So it's my absolute pleasure to welcome them onto the stage, along with Elaine Bowes.
So thank you, Henderson, and thank you all. I've just got to add my congratulations to the cast and to everyone. That was totally moving. I've actually seen it before, but actually tonight was something different. And we're now going to move into our post-show discussion, which gives us a chance to reflect on some of the themes that came up in the play that we've just seen, and to explore the real-life issues behind what we've just seen. So to start off with, I am going to ask our panel of experts, health professionals, a few questions about early diagnosis and treatment and the importance of talking openly about men's health. And then we're going to actually invite some of the men that you saw on the stage with lived experience to join the panel so you can ask everyone, all of them, your questions. So we're going to begin by welcoming our panel, and then I will ask them questions. So we will start, not with you. We're going to start with Grace. This is Grace Zizengwe, who is a prostate cancer advanced nurse practitioner. Beside Grace is Naman Julka-Anderson, who's a therapeutic radiographer and allied health professional and clinical advisor for Macmillan Cancer Support. And last but not least is Anthony Cunliffe, GP and National Lead Medical Advisor at Macmillan Cancer Support. So my first... So my first set of questions actually is for you, Grace. So we heard in the play about the side effects of cancer treatment. Can you first of all tell us what are the available treatment options?
Thank you, Elaine. Can you hear me okay? Brilliant. So I think first of all, it's good to understand that prostate cancer can be, once it's diagnosed, it can be diagnosed early, so it's a localized disease, or it can be diagnosed late, and that's an advanced disease, so it is metastatic, so it has spread to other organs. So your treatment options that are available depends on the level of the prostate cancer. So if it is a localized prostate cancer, you can get surgery, you can get radiotherapy, you can get brachytherapy, which is small pellet seeds that are radioactive that are put in the prostate. You can get focal therapy, but also if it's a low-grade, low-risk type of cancer, you don't need treatment imminently. You just need regular blood tests, MRI scans, and PSAs. But if it's at an advanced stage, unfortunately, the treatment options that are available are not curative anymore. But they are certainly there to improve the quality of life, but also to extend the quality of life. What determines which treatment you are going to have obviously depends on the cancer that you've got.
Thank you very much, Grace. So clearly, your clinician, your team, would decide what's best for you. But as a patient, can you have any involvement or be part of the decision-making about the treatment options?
Most certainly, and this is something that I think sometimes patients feel that they don't have a voice. Clinicians can guide you on the treatment options that are available to you when they're looking at it from a disease point of view, from a success point of view, and everything. But you've got a choice, you've got a voice. In the NHS, we believe that there's no treatment about me without me. You have a voice, but you have to understand what you're being offered. You have to understand what you're saying no to. You got to understand what you're saying yes to. And the only way you can understand is if you're well informed, you're given all the side effects and the advantages of having the procedure and also the disadvantages of having it or of not doing anything. So you do have a voice, and yes, all cases for any cancer, for prostate cancer, before you go on to have any treatment is discussed in a multidisciplinary meeting where there is radiologist, oncologist, urologist, nurses, everybody who will be involved in your care to participate. But also quite influential is the nurses, because sometimes those are the people you meet there. So they are your advocate in those meetings because they have met you. So they'll tell you, they will be able to say, actually, what you're proposing for that gentleman, I know him, he doesn't like that. And your team is able to work with you.
Thank you very much, Grace. I just wanted us to talk a bit now about the side effects of treatment. Would I be right in saying that the milder the treatments that you have, the lesser the side effects, and the more aggressive treatments have, more challenging side effects?
It's not as clear-cut as that. I think the milder the cancer, the less invasive the treatments you can have. But if it is an aggressive type of cancer, which is, let's say for surgery, if we use surgery as an example, if it's almost coming out of the prostate, sometimes they do an operation to serve the nerves so that you don't have any problems with erection. We try to maintain your erections as much as possible. But if your disease is towards the end, it's almost coming out of the prostate, it's difficult to spare the nerves. So the surgeon has to go wider so they can't save the nerves. So if that's the case, it's kind of difficult. Although it's it might not be an aggressive type of cancer, but it's where it is that determines how they're going to do it. So your side effects, sometimes it's all determined with the treatment that you've had, but also your perception of it and how well prepared you are. Because I think side effects, they're there, but we all assume that they're bothersome. Yet with some patients, they might be experiencing the same side effects. For example, hot flushes. Some patients, they might be experiencing hot flushes if they are on hormone therapy. And for them, they've prepared themselves, they know how to manage it. It's not a bother. But for some people, the hot flushes are just life-changing. They can't do anything. And yet, it's two people having the same treatment, but it's just how well prepared or the perception or how well supported you are with the treatment.
Thank you very much, Grace. So we heard quite a bit about erectile dysfunction in the play. Is it inevitable?
I think living with a cancer diagnosis on its own is enough to cause anybody any psychological distress. And if you're not okay psychologically, it's going to affect your erection. So even if you're on what's called active surveillance, where you're not getting any treatment, you are going to get some degree of erectile dysfunction or sexual function. I like the word sexual function better because erectile dysfunction just looks at erections, but I think let's look at it as a whole, the sexual function. Then the honest truth is that there is no treatment that you're going to get that is not going to affect your sexual function for prostate cancer. It's to what degree it affects is what's important. But there's help out there. There's a lot of things that we can do. So listening to the play, it's like I was actually sitting in a consultation because those are the certain things that we go through with our patients. But if you know what's coming and you know that there is support and there is a lot of things that we can do. So yes, there is a pump, which you saw. It's not as gruesome as that in real life. It's not. You use... in post-surgery, you use that from, I like to call it like physiotherapy. Right, it helps blood flow supply. If you've had surgery, really, there's three mechanisms that are needed for erectile function. Good blood flow supply, good muscle, good nerve conductivity. All those three things are damaged during any surgery, right? By using a pump, you are actually helping naturally the blood flow to the penis. It helps with maintaining the penile length, because if you don't have blood flow supply to the penis, what you'll find is that it will shrink and you will have penile atrophy. So that's why most people lose penile length. Yes, the surgery does cause, to a certain degree, some penile length shortening, but with using the pump, it helps. So you can use a pump. There is tablets, so the Viagra tablets. I think when Viagra came originally, it was not well tolerated and it was not well used, but it is actually a safe tablet and it's only in the body for the time that you are having it. It only lasts 4 to 5 hours in the body. These other tablets like tadalafil, which falls in the same family. So what works for one patient doesn't work for the other. There's injections which we can use, and those injections are just localized to the penis, and it helps with penile function. There's a cream that you can use that you just put inside the urethra, and you massage, and you have an erection. So there's a lot of things that you can do, but also psychologically, there's a lot of help that's out there. We offer psychosexual counseling, we offer CBT. There is a lot of things that we can do, but I think most of the time we focus so much on the patient that we forget that actually erectile dysfunction is a couple's disease. You need both people to be participating in it. So getting people in a conversation, talking about it with the partners, demystifying any myths, but also asking that question to the couple, how is your sex life? And let them define what is their sex life. And then you take it from there. Whether you're straight or you're gay, everybody's affected one way or the other when you have the treatment of prostate cancer.
Thank you very much. Thank you very much, Grace. So, so my next set of questions is to you, Naman, and it's around the alternative remedies, and we saw the scene about how many people, and in fact, indeed, when we did the quiz, how many people felt that actually alternative remedies could cure cancer. In your view, how much does fear and anxiety mean that people go to alternative remedies and then may delay treatment? How big is that? How big an impact is that?
I think the word cancer has a huge impact on everyone. So not just the person who's been diagnosed, but also their families, relatives, etc. I think in our community, so I was born and raised in India, the C word is a bit of a taboo. You don't want to talk about it because it is a death sentence.
Yeah.
And actually, I think something I got from the play and obviously the quiz as well is the distrust. I think coming here from India is the same for me. You don't trust the healthcare system. And as a clinician, I think looking at controlled trials, etc., all the evidence, the databases and the people who've been involved have mainly been white people.
Yeah.
So there is that to fend with the science side. I'd have to say that Mikey's marketing strategy was pretty good.
Yes.
And that's probably what we hear from patients all the time, that someone has given them some spinach or something. It doesn't mean there isn't a place for this. It's still healthy eating, healthy lifestyles, alternative medicine, and I think it's coming around again with marketing in like M&S. So I grew up drinking turmeric ginger shots at home with my nanny, but it's now an M&S for £4.50 or whatever.
Yeah.
So it's the same stuff that we've grown up with non-Westernized medicine. It does work, it has a place, but it doesn't mean that there's a science behind it to say it's better than surgery. So if there is a tumour and you have the opportunity to cut it out, it's gone. So that means the margins and all the other alternative medicines, yes, we give you lots of side effects, but we know that for decades that this has worked. And actually some of the technology we have has moved, advanced so much. So my colleague Joe and I were at a conference today, and there's a trial called ERECT, very timely, very well said for erectile dysfunction, but it's using technology where they're sparing all the nerves from radiotherapy. But something like that is a huge hope to younger people or anyone. I've treated a 100-year-old who wanted to have sex. It doesn't mean you have to be old or whatever, but I think the alternative medicines, it's scary because the misinformation, I'd say market is huge at the moment. Everywhere you go online, the algorithms will pick up what you're searching, what you're looking for, and it will feed that for you. And I think it's really hard without the trusted faces, but obviously there aren't always enough faces like us that are trusted. Yeah. So I think that is one element that, obviously speaking to like Paul and everybody else that's been on today, that's where you have to trust your communities. And hopefully now with the quiz that was done with our amazing colleague, those myths have been kind of dispelled around the alternative medicines. But I think the spirituality, the religion, that all has a place to help support with conventional medicine at the same time. I don't think it means you can just ignore it. You're allowed to be spiritual. That also, I think for some communities like mine, that you're told to pray away the cancer. You can still pray. I would still argue that you should go to hospital and get some treatment as well. That doesn't mean you can't pray at the same time. That's my opinion, but yeah.
So that's really, really interesting, Naman, because we talk about alternative therapies, but of course a lot of people might like to think, and what you were mentioning there was complementary therapies that complement your conventional therapies. Do you think there's a role for the NHS, where we will go when when we're diagnosed like this, to actually do more to kind of bring the two together? The complementary remedies along with conventional remedies. So someone doesn't have to think, I'm going to go over there for something alternative, but actually I can have a very holistic, experience in treatment. Maybe the NHS should be doing something like that.
I'd probably say we are, and to some extent. Some places there will be more of a postcode lottery. So obviously acupuncture is something that helps with hot flushes for people with prostate cancer. It works really well, and there is science behind it. I personally find it quite painful, but it does work for quite a few people. Yes. I think with the NHS, you, as a professional, you're always bound by your professional code, your degrees, everything. We don't want to give hope in the wrong way. Yeah. So where there isn't enough evidence, we will hide behind that. And I'll admit that I've done that before. But I think working with the community to understand what they are comfortable with and how it can complement the science at the same time, that's where it should be. And I think a lot of these services are on referral from the NHS. Lots of people don't know they are. You can be referred for acupuncture. If you want to have treatment in a different city, you can request it. Yes. You don't have to have treatment at your local department. You could go to Scotland if you want to. It's not as easy to do, but there are these things that maybe we don't always talk about with our patients.
Yeah. So there's a role for a bit more, actually. Yeah. You did mention, you were talking about well-being and mental health after following cancer diagnosis. What are some of the effects that you see with people when, in relation to their mental health and their well-being when they've had that kind of diagnosis?
I think to be stereotypical as a man, we often struggle to talk about our emotions, and that's always portrayed. But actually, if you do go to some men's supports groups, people are very open to talk about what they're going through, or in certain settings like the barbershop or wherever, we do talk. And I think some of the element is also to get away from the stigma that men don't like to talk about their feelings. We just do it in a different way. We might do it while we're watching football, or taking the mick out of each other about something. That's how we express our feelings and things like that. And I think I've had this conversation with Paul quite a few times, that actually the humour element, or having that connection with your healthcare professional, instead of just being science, actually having a bit of a bromance or something like that, that is what's going to help support us.
Yes.
I think for mental health support, there is a struggle in the NHS at the moment, but I would argue that actually your clinical nurse specialists, your therapeutic radiographers, your GPs, everyone, we are there to help you. When patients say to us, I don't want to bother you because you've got too much on your plate, I don't care, I want to help you, that's why you're in front of me. I think that's one of the elements where we should be working with our patients to say, no, give me more work to do. If you found some research, let me go and find out and give you the right information back. I think don't be scared to ask for a second opinion or challenge us. We do potentially sometimes always know best, but so do you. It's your body. You know what works well for you, and I think it's good to be able to challenge us back and keep us on our toes.
Brilliant. That's really good. You've mentioned something there, second opinions. I think you might have patients who might be thinking about it, but might be a bit nervous about saying to you, well, actually, I'd like to hear from somebody else, because it might sound as if they're saying you don't know what you're talking about. But tell us about how we can do that, and how we should feel empowered to do that.
I think, again, it's the authority element that you're speaking to a doctor or a healthcare professional and they're telling you something and you're trusting them. You can request a second, third, fourth opinion as much as you want, but I find that in oncology, perhaps we rush our patients to making a quick decision because it's cancer, we want to get you through the system, but actually you can request a second opinion and it can be very quick. And I think, I don't want to say too much because Anthony's GP, I don't want him to be getting lots of second opinions, but it's about working together, I think, you're entitled to a second opinion. Yeah. If you don't agree with someone, similar to a digital rectal exam, if you don't trust your GP, you don't want them to put your finger up your bum. You're allowed to say that. Yeah. It's okay. It doesn't mean that someone else isn't going to be able to do it for you.
Excellent. Thank you very much, Roman. Thank you. So, Anthony, you're a GP.
Yeah.
And of course, you're most likely to be the first port of call for somebody who may later go on to get a diagnosis of prostate cancer. So, actually, on my cue card, it says, what is a DRE? But we all know.
We all know now, that's for sure.
What DRE is. Right, so direct rectal...
digital rectal examination.
Digital rectal examination. Yeah. Digital. Not digited as in, but finger. Digital.
Yeah.
Right, okay, great. Just be clear. So, really, Anthony, is it essential? Do you have to have one?
The ultimate answer is no, and that should be the overall message. So, because we hear a lot about people being put off going to even discuss prostate cancer because they think that's going to be part of the process to get diagnosed or reassured, of course. Mm-hmm. So the overall answer is no. And certainly, I think we've got to look at prostate cancer in two different ways, and there's been a lot about prostate cancer screening in the media recently, and so it does depend a little bit on whether you have symptoms. So if you've got a man that's presenting with symptoms which might be peeing more at night than they used to, the pee not coming out like it used to, a bit of urgency when they need a pee. If you're presenting to a GP with those symptoms, one of the things we should be thinking about is prostate cancer, especially over a certain age. And we should be asking lots more questions around it to try and understand, perhaps what the risk is. And for people with symptoms, one of the things that we should offer a patient is a rectal examination, because because it's not just about diagnosing prostate cancer, because there are other things that can cause these symptoms, and the information we find from a rectal examination can help how we manage that. But, and this is a big but, and the message I'd want to take home, so certainly for people without symptoms, there's consensus now that a rectal examination is not needed, and that people can just opt to have the blood test. We do have to caveat a little bit that there is a small risk of a false negative PSA, so but that doesn't mean somebody needs a rectal examination necessarily at that time. But what we should absolutely be doing is, if somebody's having a PSA and they decline the rectal examination, which absolutely everybody should feel empowered to do, we should safety net them to make sure that if they then do develop symptoms, they do come in, and at that point a rectal examination might be offered again and might have different usefulness in that situation. So if somebody's not got symptoms, it's definitely not needed, but if somebody has got symptoms, it might be offered and it might have different uses, but at the same time, declining it is absolutely fine, and it shouldn't impact, it certainly shouldn't impact on being able to have a PSA. That's, however, unfortunately, we still hear lots of stories of people going to the GP and being firstly declined the prostate blood test, which shouldn't be happening, certainly in black men over 45, member of the family history over 45, any man over 50, nobody should be being declined the PSA blood test. And certainly they shouldn't feel forced into a rectal examination to have the blood test. That's just an absolute no.
Great, that's really important. That's really important intelligence. Can you tell us, Anthony, is there any data that tells us how many men actually do refuse to have that, the DRE?
Yeah, no, we don't know that data because that's held in primary care records, and we don't troll through for that data. I think it would be I don't know how you'd find out the information, but I think it would be interesting, not how many people decline, because that's somebody making their own decision. I wonder how many people feel or go through with the test a little bit like what we saw, even though they really don't want it to happen, but they don't feel able to say to the GP, look, I want the blood test, I don't want the exam. And I do think things are changing, and I do hope, at least, that GPs wouldn't respond negatively to that, or most GPs wouldn't respond negatively to that, because we're all understanding more actually how useful a rectal examination is, especially in a doctor that doesn't do it much. Your specialists who are doing them all the time will get a lot more information from that examination. As a GP, depending on how often you do it, you might not even be getting that much information from it. So absolutely saying to your GP, if you're not comfortable with that, don't have it, being able to say I don't want it done. A lot of GPs now might not even offer it because of this consensus, certainly if you've not got symptoms. So we really don't want it doing is putting people off asking for, talking about prostate cancer, asking for a PSA blood test for whatever reason. Whether that's because you've just seen something on telly, you've chatted to somebody who's just been diagnosed, you've heard people talking about it, whatever, all them reasons. We want them to bring people forward to have a PSA blood test, and they shouldn't feel that there's any barriers there.
Yeah, a lot of that's got to do with actually how we, as the public, your patients, interact with the NHS services and our GP services, and how confident we feel, and how empowered, I'll use the word again, how empowered we feel to actually have a say in our treatment. And I think if we felt we could share better, then there'd be a better relationship and there'd probably be better outcomes.
Yeah, absolutely. But as healthcare professionals, we're so culpable there, because it only takes one bad experience with a healthcare professional to impact on how willing you are to come forward again. And so, we have this massive responsibility as healthcare professionals, not only to think about all the medical elements, but really to think about the person that's in front of us, ask, what issues, what concerns, what priorities they may have, because we do want to break down the barriers of, especially for marginalised populations, and not just black men and women, but all marginalised populations are often having poor experiences of care, and it really does impact on them coming forward again to see a healthcare professional.
Absolutely. Can you tell us about, because Naman mentioned things are changing all the time, there are recent developments. In recent years, how have things moved on in terms of diagnosing prostate cancer?
Yeah, I mean, we could talk about it for a long time, but I think the main thing we want to talk about is the introduction of magnetic resonance imaging scanning, so MRI scanning.
Right.
After a positive PSA. So what used to happen, and this was part of the reason a GP would have maybe a pretty hefty conversation before doing a PSA, because you have a raised PSA, it does not mean you've got prostate cancer. There's lots of reasons for a raised PSA. So you have a raised PSA, we definitely then need to send you on for further tests. But what used to happen is that first test was a prostate biopsy with no more information. Right. So along with that biopsy, there were lots of risks. Well, it was uncomfortable, not a pleasant procedure, but there was also lots of risks about infections afterwards, and for some people, fairly significant infections and sepsis afterwards. So as a GP, we were taught to really counsel a patient that if they've got a positive test, we'll have to refer them on, and they're going to have this really unpleasant test with risks. Now, things have changed now. The majority of people, and certainly in London, if your PSA is raised, your next test will be an MRI scan, which isn't invasive. Yeah. And after that MRI scan, people may then, most men will then need a biopsy, but they're having a biopsy with lots more information and making sure that the right part of the gland's being biopsied. But the better thing is a lot of men won't then need to have a biopsy if the MRI scan says they don't need one. So them risks have massively reduced, and really we need to make sure that all GPs understand that, so that kind of conversation we need to have around counselling about a raised PSA test is just not quite the same, because the follow-on tests that people are having just don't have the same risks that they used to.
Brilliant, that's good. Thanks so much for that. Anthony, my final question to you is, and you actually did touch on this a bit earlier, what advice would you give to your fellow GPs when they're faced with diagnosing prostate cancer?
Well, certainly when people coming forward, the message we want to get out to GPs is it's not our role to decline a PSA. It's just not. I mean, if somebody comes forward at 30 or very young, we should be having a conversation because the risk is incredibly low. But certainly any man over 50. But now we do know that black men over 45, men with a family history, irrelevant of ethnicity over 45, they're at a higher risk. So any men in those groups, we should be welcoming them with open arms to do a PSA test, because we do know that that those groups are more likely to get it earlier and potentially more aggressively, and we want to diagnose it early. So that's the main message we need to get out to GPs, that we shouldn't be putting any barriers for men in these groups to have a PSA test. Definitely understanding that things have changed and the MRIs are there for everyone really after a PSA test now. So those risks we used to worry about just aren't there. And that, like we heard about prostate cancer treatments, there have been lots of advances. So we are luckily seeing more treatments coming through that hopefully will demonstrate less side effects and less impact on things like erectile dysfunction, which is obviously really important to most men being diagnosed with prostate cancer. So just like with all cancers, we need GPs to be up to date. And it is difficult. We don't just manage cancer, we manage all diseases, and we need to be up to date on them all in many ways. But there are, and from as well as Macmillan, I work for South East London Cancer Alliance, and certainly we do a lot to try and educate GPs on these really important points. So really making sure GPs are up to date so that they're giving the right advice. And second opinion, go and see your GP. If you've been hearing something in a hospital and you just want to chat things through, ask your GP as well, because most of us would be comfortable talking about that.
Excellent. Thank you very much.
Thank you. Thanks for having us.
Thank you. So, thank you to our panel of health experts. We are now going to ask the men from the play with lived experience to join us. Lived experiences are at the heart of Barbershop Uncut stories, and we're honoured to have them here tonight to share their perspectives and now to answer your questions. So we welcome Paul Campbell. Paul. Welcome, Paul. Jeff Thompson. Welcome again, Jeff. Wayne Campbell. And last but not least, Barber-Anderson Boyce. Thank you very much. Thank you very much, gentlemen. And to everyone else, can we have some light, please, so we can see everybody? Because this is the part where you, the audience, are able to ask our enlarged panel here any questions that you have, either about the play or about prostate cancer.
Or Arsenal.
Sorry?
Come on.
Stay away from that, please. Stay away from that, please. Thank you.
So, have we got a roving mic? We got a mic?
Yeah,
Oh, thank you very much.
I'll pass it around.
Thank you very much.
Shaq, you take the mic, you pass it around. That's my son.
I'll pick up the son.
Hi, I just want to quickly say the play was absolutely amazing, guys. Thank you so much, so informative. But my question is, why is prostate cancer so prevalent in black men?
Is this to the medics? Anthony.
So we know it's a variance in, we see this variance in incidence of prostate cancer in black men, but so it's an ethnicity risk, but we don't know exactly why. If we look at all different cancers, we'll see increased rates of some cancers in some ethnicities and less cancers in some ethnicities. So we have the data, but we don't know why. And that's there's no kind of risk factor that an individual can modify. So we know with a lot of cancers, there's risk factors like smoking, obesity, alcohol, things like this that people can actually modify to reduce their risk. But unfortunately, when it comes to risks associated with ethnicity, there's nothing an individual can do, which is why we need the important things are us raising awareness of that increased risk and really encouraging people and trying to break down the barriers to coming forward to getting tested for cancers. Yeah.
Can I just add very quickly? Sorry. That I think for some communities, so black and brown communities, we often present later because we don't often maybe get screened early enough, might not get checked out, might not believe it's cancer, might not want to talk about it. There's all those other aspects of a higher or more aggressive cancer as well, I think, to consider.
And I think also what we don't know is because we don't have much participant in research as black community. So as we are talking more about it and as we are now coming out and participating in research, we are encouraging people to actually, if we're going to understand the disease, if we're going to devise treatments that are very targeted to what's going on, we need to participate in the research so that we are actually well represented but well understood.
Hi, thank you very much, and kudos to all the men. Thank you for doing this. I'm just campaigning that one be held for women as well. My question is nutrition. We know nutrition plays a vital role when it comes to these things. Are people being educated about it? And I throw this to our dear men who took part in the play. How has nutrition played a part? Has your diet changed? What are some of the things you didn't know that you now know, which you would advise people to take note of? Thank you.
Am I on? Yeah. That's a very good question. I tell you what happened. I mean, I was one of those guys where I was on an alkaline diet and never thought that, prostate cancer would even come my way. After I was diagnosed with prostate cancer, the strangest thing is my doctor then said to me, you need to change your diet and eat more oily fish and more sort of Mediterranean type of meals. And I'm thinking, so why didn't you tell me this before? Why didn't you discuss the dietary recommendations before? Why wait until someone's been diagnosed with prostate cancer, then you say, this is what you need to do. So, yes, I've actually had to maintain the diet that I was on, and it's helped me. And I must say, I'm not going to say it didn't help. All the erectile dysfunctions and so on that we experience, I must say, I'm good. Lazarus has risen. Yeah. So yes, a diet is important. It's very important to change your diet, because so much stuff that we eat nowadays has got so much chemical-based, stuff in it. And I mean, half of the time you go into the stores anyway, you think you're eating healthy, but you're not really. So you just got to take charge of yourself, because no one's going to do it for you. You've got to do some research and make sure that you are putting in the right things in your body that's going to help your body, because what we eat is what we are, right?
Yeah. Can I add to that? When I was told that I had prostate cancer, and just after my brother was notified that he had cancer, we had two very different treatment paths that we took. I decided that I was going to become a ninja. I was going to cure cancer with quinoa. I'm going to just eat my way to health. And not too a bit dissimilar to what I was talking about in the play. I did a lot of research around alternative methods, and I started to look into all of these different ways. I gave up alcohol, I gave up smoking, I gave up fillet of fish. I love a fillet of fish, Jeez. I gave up all of these foods because,
For how long? For how long? 2 weeks?
Can I talk, please?
All right, I'm just saying, just tell them how long.
Some people just let me talk.
But be honest, though.
All right, I'm just saying. So anyway, then I'm giving up all of these things. And
for how long?
Can I
No,
talk?
that's what I'm seeing between you guys, yeah?
Quinoa became my best friend. And no respect in the place. So anyway, what was happening is that for a period of time, and having a healthy diet is good, but you have to have a support structure and you have to have people around you who can help you to achieve that. So I realized that slowly but surely I was creeping back into old habits. I'd go out and somebody'd be like, it's his birthday, let's just have a quick drink, and just a little bit. And that little bit turned into more, and then my diet had completely just evaporated. And I was back to old habits. And I think the biggest issue that I had around diet was that, it was fine for a minute, but the hardest thing is to stick that course, on your own. And that's where I felt that the problem was. Changing wasn't an issue. Sticking absolutely was.
Discipline.
Yeah, I clearly got no discipline.
Just wanted to say, football aside, like everyone said, it's an amazing play. Even though I've had conversations with P, Wayne, I was moved by what you guys said. So once again, I think we all need to put our hands together for you guys and all the actors and our professionals. It's bad.
Is to stick that course, on your own. And that's where I felt that the problem was. Changing wasn't an issue. Sticking absolutely was.
Discipline.
Yeah, I clearly got no discipline.
Just wanted to say, football aside, like everyone said, it's an amazing play. Even though I've had conversations with P, Wayne, I was moved by what you guys said. So once again, I think we all need to put our hands together for you guys and all the actors and our professionals. It's bad. What I wanted to find out from you is I'm quite blessed because my circle, we will have those conversations. Do you know what I mean? But what could you share to help those people who can't have those conversations? Because we need to be talking, we need to be sharing. So what little tidbits could you guys impart so that maybe there's somebody here who they want to have those conversations in their circle and it can help break that down? So Anderson first, man.
I had
Yeah,
a
it's
feeling
a no.
you were going to come to me. I genuinely feel that there is strength in what we try to use in the play, and that's like a comedic element, like to try and make light of it, right? It's always heavy, it's always conversation that people don't want to have, people are running away from. So do you know what? A culturally appropriate space like the barbershop is a great starting point, yeah, to get rid of some of that heaviness, bring in a more light-hearted approach, make it conversation. You know, as often as we talk about football or music or blah, 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 why can't we incorporate our health into these conversations? There's no reason good enough, right? So I think that's a great starting point, which is what one of the things we try to highlight in the play is that, you know, give it a bit of a spin, a bit of a comedic twist, a bit of a light-hearted approach, and that helps to kick down some of the taboos that come with these heavy conversations, I guess.
I remember having a conversation with my brother when I was first let out of hospital. We were in my garden, we were sat down, just resting, and then he said something funny, and I wet myself, like you do. But it was the fact that we were able to just laugh about it. It didn't become an embarrassment. It's like, all right, then, if we need people to hear about these stories, we have to become vulnerable. It doesn't work otherwise. You know what I'm saying? So we have to be able to put our hands up and say, I'm going to talk about wearing pads or Gucci nappies.
And I guess we use ourselves as tools, and we're happy to do that. And I think when the messaging changes, how we talk about cancers, you know, myself and Jeff's charities, we provide culturally appropriate and relevant information to black and ethnic minority communities, and it's what that looks like. So when we were going on our journeys, if I saw messaging that attracted my eye, I might have gone into that. I might have gone there, but I didn't. So it's about being open to what's out there, going online and see if there are support groups out there, and again, having a group of friends, colleagues, associates that you can be vulnerable with and talk, and because we got no shame. We're out here, we're talking about our business.
Talk about yourself, mate.
Everything I said out there about that was all true. It happened that way. Different language, of course. But yeah, I guess it's about the messaging and having those people that you can speak to, because it's not easy to talk. When I was diagnosed, I kind of disappeared from my family for around 18 months. And then I found the courage to come back and tell them about my diagnosis. So it's about having the right pieces in place. So one of my best friends is here. She was one of the first to know. And because of that contact and communication and our relationship, she was able to steady the ship. And when I had those sad days and down days, she was able to pick me up. So you need those special people, those special services, those special associates and colleagues in your life that you can kind of reel in when you need them there.
And can I add to that?
Again?
Yes. One of the main things that I believe can really help is education, and educating from young, because so many young men do not know they have a prostate, and even if they do know they have a prostate, they do not know what the purpose of the prostate is. And the more you encourage, I mean, come on, they have sex education. You talk about how to have babies, but you don't actually talk about the real nitty-gritty, that little thing that causes the semen to be built up. Not just young men, and many adults don't know also that they have a prostate and the purpose of that prostate. So education to me is very, very important. Educate from the young, okay? So that will eventually break the taboos as they get older. So it'll be no longer a secret conversation. It's open. And we guys are very transparent. And this also helps other men to be able to talk up, speak. Earlier on, we were talking about men crying. And, you know, a lot of men say, oh, I ain't going to cry. But then we all just, found out that at the end of the day, when you cry, and you could cry in front of your wife, your children, or whoever, that doesn't signify weakness. It signifies strength. Yes. Yeah? So we got to sort of get off that high horse. I don't want to cry. You know, some of us, our parents, will be giving us good hiding. Then all of a sudden, what are you crying for? Man, don't cry. Or you fall down, you hurt yourself. Oh, there, don't worry about it. Stop the crying. Yeah? But it is important for men to get in tune with their vulnerability. It's in tune. You get in tune with that. All of us got feminine sides. Don't feel embarrassed to talk about it, because it's a part of our makeup. And the more you talk, as I've always said, talking is the first step to your healing, but talk to the right people.
So I'm really excited to say that we have quite a few hands up and questions, but I've just been informed by my boss over there that we've got to cut this in a minute. So we have one last question. And Marcy's got the mic.
We're taking any questions on Arsenal and how we're going to win the
Time's
championship.
running out. Time's running out.
You know, so
Oh, blessings to you, Anderson, to Paul, to Wayne, and to Jeff. Thank you so much, and to the panel. Thank you for normalising this conversation. I don't think I've ever seen a group of so many black people in one space, and we're talking about sex and our bodily parts. So we've really moved a long way from our parents and our grandparents and our seniors' generation. What I wanted to talk about, and you've alluded to some of it already, your own personal support. So when you received your individual diagnoses, were your GPs or your health professionals proactive in directing you to any elements of support? And did you start? I know the answer, but it's important to hear that. And I know some of you set up your own charities and your own groups as a result of that. That's my question. Thanks.
Yeah, I'll go first. When I was diagnosed, it was quite horrendous because he looked at my notes, he looked at me, he looks at my notes, he looked at me, and then he was like, oh no, and then he hugged me. And at this time, he hadn't said that I'd been diagnosed with cancer. And then when he said that, he left, and then he told me about some of the side effects. He left the room, a therapeutic nurse came in, and he said, we need to talk about your diagnosis. And I was like, I need to process this, so give me let me come back to you. And this guy kind of refused to budge. He was just there looking at me. I was quite intimidated. I didn't know what to do. And I was like, I need to process this. Give me your card and we can talk about this. And he was quite insistent that we talk about it there and then. And so I got out of that situation. And that same day, I was going to meet my sons to watch Arsenal versus Newcastle. And regrettably, it came out and I told them. So I didn't set the scene. I didn't process the information. And I just regurgitated it at them. And we kind of just sat there in silence. I went from Batman to Superman to old man in that instance. And it was the first time that they'd seen me be vulnerable. And it was difficult at that time. And because of how they responded to me, because of my response to them, it was sort of a barrier. And then I had some other friends that I spoke to at the time. I didn't tell my immediate family, my brothers, my sisters. That didn't go down well. And it's just key to have those special people, those special relationships, like I was saying earlier. And I think because we're all individual, we're going to take different paths to find our fulfillment in that as well. And, I do regret how I told my sons. I do regret not telling my siblings earlier. But, I lived and I've learned, and, I'll do things differently going forward.
Thank you very much.
Yeah, I myself, a different journey. When I was diagnosed, I felt I was on a conveyor belt. I had the prostate removed, and I wasn't really informed about the real side effects and also the mental implication that having cancer would have caused. And so, having not had that, I then, felt so alone. Even though, God bless Macmillan, there were a Macmillan nurse there to, sort of guide me. I didn't feel that she was able to understand me and my manhood and what was going on. Yeah. So there were issues started to rise up, and I remember I spoke to my son. He was the first one that I told prostate cancer. I never forget his birthday, and every year I would call him, happy birthday, are we doing something? This year I totally forgot. He called me and said, Dad, do you know what day is it today? And I was totally not interested, because I'm thinking I've got cancer, I'm going to die. And eventually, I literally just tore him to bits. I swore at him down the phone. I literally just ripped him apart. This is someone that I love so much. Yeah. And cancer just came and erupted my mind mentally, literally destroyed me. So to the point where going on, and after having my surgery, I couldn't cope. And what do? I tried to commit suicide. And after that, it's when I woke up and I thought, cancer didn't kill me. Why am I trying to kill myself? And that's why I then set up Cancer, Don't Let It Win. And I'm quite proud now because we got over 4,000 plus members. And these are all black men. Right? So yeah, sometimes some patients can actually go missing, you know? And the aftercare, I think, is important. I think it's important that when a man's been diagnosed with prostate cancer, you have some kind of body there, someone who got lived experience that can actually say, listen, I've been through it. Let me walk that walk with you. And just explain to you the steps and what you're going to experience, because that way, it's a load shared, it makes it easier. And if I had that, I don't think I would have gone down that road. So that's why I now supply that type of support to my community.
Thank you. Thank you very much.
When I was diagnosed with prostate cancer, I actually waited 3 years before I got treated because I just convinced myself that there was no culturally sensitive material. I didn't see people who looked like me dealing with issues as complex as this. And when I was given support by the hospital via a Zoom call, it was with this patient, this white guy, probably 80 years old, talking about his lived experience. We were night and day, we were so far apart, so I waited a long time. But when I eventually got treated, when I eventually decided that I needed to do this, I turned to the internet, actually, and I turned to sharing my stories with other people out there. So I did video diaries, and I would share what it was like having a catheter, what it was like having to sit in bed all day and watch Married at First Sight. So I would share these stories, and I'd try and make it and personalize it, and that for me was very, very, very cathartic, and it also allowed me to kind of break down barriers. One of the things I also do is play percussion. And I remember when I was well enough to go back out and drum, one of the things that hit me, one of the first thoughts I had is, some of these people who are in the audiences, they're my peers, and they know me as a percussionist, but they're going to know now that I had my prostate removed and all of the complications that go with that. How are they going to respond? And I remember some guy coming to me after the gig, and he just gave me a big, massive hug and said, please keep doing what you're doing. So social media in the capacity for me to tell my story was amazing. And I met some really, really powerful individuals on there who became kind of the support structure that I needed. You know, like I said, like my brother said, he ran off. You know what I mean? So there were people who had to fill that void. And it was important and it was powerful. And everything hinged on my ability to become vulnerable and see that vulnerability as a necessity so that other people could benefit from this journey.
Thank you. Did you know, I can't tell you how moved I am by your stories, by your testimonies, and I really want to thank you for being so open and candid. It makes such a difference, and I really do hope that there are people in here tonight that will maybe going through something around similar issues as you are going to be kind of emboldened by what you've had to say. Thank you very much. So at this time, I'm going to also thank Anthony, Naman, and Grace for being with us this evening. It's been excellent. I think it's been a really brilliant night, actually. All in all, I think you're just bringing together lived experience, the clinicians, and all of us really to be able to speak so openly about this. I've never experienced anything quite like this, really, and it's wonderful. It's wonderful. I said I've never experienced anything quite like this, and it's been amazing. Oh, thank you, thank you. So, without further ado, I'm actually going to invite Lorna back onto the stage. Lorna is the visionary and creator, the kind of mastermindy person behind all of this. And she's going to close it all off for us. And thank you all as well for being. That's my mum, by the way. Mum, you can't talk yet. It's not finished. That's my sister. That's my sister. Thanks, Mum. You're proud. Thanks, Mum. Thank you so much. And my son. Oh, my God. Thanks, son. He came up and did the game twice. Thank you. We have to leave shortly because we get a fine if I'm late, so that's why we're speeding on. So thanks so much to the panel. Deeply appreciate your insights tonight. To Elaine Bowes, my sister, who chaired that, so eloquently. And we obviously could go on and on tonight. And of course to these men who we've seen earlier on today. And, we've just had the opportunity just to share a bit of their experience. So I am going to close. We've come to the end of the evening. Deeply grateful to our cast for, as I said, their courage. To our health professionals for their expertise, to the hosts, who guided the evening and the discussion, and of course to our sponsors, Selka and Southwark. If they didn't sponsor us, we wouldn't be here tonight. So grateful, very grateful, eternally grateful. Yeah, and they didn't take much persuading, actually. It's very hard, obviously, to get funding for anything at any time. But I'd had a couple of conversations. They said, yes, we are right behind you. And that meant a lot. That meant the world. And, of course, to every one of you tonight in the audience for listening and engaging with us. When I first set out to create Barbershop Uncut Stories, the vision was very simple. Just to use familiar, a trusted space of the barbershop to spark honest conversations about cancer and men's health. And November is Men's Health Awareness Month as well. Conversation that can save lives. So I put on a yearly conference, and I remember speaking to Jeff Thompson from Cancer Don't Let It Win. And I said to Jeff, because I run a service, Seen Hair, where we see men and women with cancer-related afro hair loss, and we have those conversations. And I said to Jeff, men don't, I didn't see many men, I always used to see lots of women. And I said to Jeff, men don't talk. And Jeff looked at me. He said, yes, they do. He said, put them in the right environment and they will talk all day long. Remember telling me that? So I thought, where can I put them? And I thought, you know what? Put them in the barbershop. Because I don't go into the barbershop, they must talk in there. So that's how it came about. So obviously Jeff agreed, and then Paul and Wayne agreed, and then we needed a Barbara Anderson, and they agreed to do that. But then I needed somebody to put it all together. But I needed a BAFTA-winning producer and director. We could have no less. And that was Rochelle. So wherever Rochelle is, she is the real reason why we are here today. Without Rochelle, tonight really, really wouldn't have been possible. Well done, Rochelle.
Thank you, Lorna. Oh, thank you everyone for coming, and I just really appreciate all of you coming and just seeing these amazing men's story And it was just amazing to put everything together. And when Lorna contacted me, I was just like, yeah, let's do it. And it's like, we're doing theatre. And I was just like, okay, it's my first time doing theatre. This was the first production that I've done in theatre. So yeah, I'm very grateful. Grateful to these guys to just, you know, I was shouting at them all the time, guys, come on, pull it together. And the actors, but they did well. And I'm very appreciative of you guys sharing your story, being honest, being open, and just listening to me and me yapping all the time. So yeah, it's amazing. So yeah.
Thank you so much. Thank you for this evening. We're going to ask the rest of the cast to come on, and we're going to end with our signature tune. If you please it. There you go. Rest of the guys, please come.